Ready? Okay. Dr. Prakash, I'm talking about emergencies in type 1 diabetes. Believe it or not, the commonest emergency is running out of refills. On Friday evening, you're out of insulin. So planning ahead and always seeking help at the right time is important so that you're not without insulin. Because with type 1 diabetes, not giving insulin will lead on to diabetic ketoacidosis within a few hours. So refills are important. Pump and site issues. Pump malfunctions are less common than site issues. Sometimes sites get infected, or the pumps in cannula sometimes gets bent, so the insulin is not given. Any of those things can result in high blood sugars. So ideally, when you change sites, change it during daytime or early evening, because you can find out if the site is kinked within 3 hours. If within 3 hours of changing a site, if the blood sugars are high, that means something wrong with the site which has to be changed. If the pump or site issues happen, sometimes we have to give injections. So you should always know what the basal need for the day and what are the boluses. Write that down or take pictures of your pump settings and always have it with you. It will come in handy when you call the provider with questions, because that's the question they're going to ask. What is your basal? What is your bolus? And you should be able to tell, my bolus is 1 unit for every 15 grams of carbohydrates, and my correction factor is, or my sliding scale is, 1 for every 100 or 100 milligrams of blood sugar, and so on and so forth. The commonest complications of blood sugars is blood sugar going too low or blood sugar going too high. When the blood sugar goes too low, you can go into seizures or even coma. And immediate help is, you already have the glucagon or the inhaled glucagon, which is the bascomine. You can use either one of them to bring up the blood sugar. But if the child is going through unconsciousness or seizures, the first thing is to call 911 while you're getting all these things done. The second big complication is the high blood sugars, which is resulting in vomiting, when you have to go to the emergency room and possibly take care of diabetic ketoacidosis. But the most important requirement is making sure the child gets insulin, making sure the child gets fluid so that the child doesn't get dehydrated, and monitoring the blood sugars closely. In the early stages of DKA, this can be managed at home, but once the child starts throwing up, going to the emergency room is the best thing. Thank you.